1. What is the priority nursing action when a patient with active tuberculosis reports hemoptysis and shortness of breath? Answer. Place the patient in airborne isolation and notify the healthcare provider immediately. Rationale. Hemoptysis and shortness of breath in active TB suggest pulmonary complications, such as cavitation or hemorrhage. Airborne isolation prevents transmission, and provider notification ensures rapid intervention, per CDC TB guidelines. 2. What should the nurse teach a patient about preventing TB transmission at home? Answer. Cover the mouth when coughing and wear a mask around others. Rationale. TB is spread via airborne droplets. Covering the mouth and masking reduce transmission risk, per CDC infection control guidelines. 3. What is the nurse's first action for a patient with a positive PPD test and no symptoms? Answer. Order a chest X-ray and assess for latent TB infection. Rationale. A positive PPD indicates TB exposure, but not active disease. A chest X-ray confirms latent versus active TB, per CDC diagnostic guidelines. 4. What should the nurse monitor in a patient receiving isoniazid for TB treatment? Answer. Monitor for hepatotoxicity and peripheral neuropathy. Rationale. Isoniazid can cause liver damage and nerve issues. Monitoring ensures early detection of adverse effects, per WHO TB treatment guidelines. 5. What is the priority nursing action for a patient with active TB refusing airborne isolation? Answer. Educate the patient on transmission risks and notify the infection control team. Rationale. Refusal risks spreading TB. Education promotes compliance, and infection control ensures safety, per CDC public health guidelines. 6. What should the nurse assess in a patient suspected of having pulmonary TB? Answer. Assess for cough, night sweats, and weight loss. Rationale. These are hallmark symptoms of active pulmonary TB due to Mycobacterium tuberculosis infection, per CDC clinical guidelines. 7. What is the nurse's first action for a patient with TB and a sputum culture positive for Mycobacterium tuberculosis? Answer. Initiate multi-drug therapy and maintain airborne precautions. Rationale. A positive culture confirms active TB, requiring immediate treatment and isolation to prevent transmission, per CDC treatment guidelines. 8. What should the nurse do for a patient with TB experiencing nausea from rifampin? Answer. Administer rifampin with food and notify the provider. Rationale. Rifampin causes GI upset, which food can mitigate. Notification ensures dose adjustments, per WHO TB treatment guidelines. 9. What is the priority nursing action for a patient with TB developing multi-drug-resistant TB, MDR-TB? Answer. Notify the provider and consult an infectious disease specialist. Rationale. MDR-TB requires specialized regimens. Notification and consultation ensure effective treatment, per CDC MDR-TB guidelines. 10. What should the nurse include in discharge teaching for a patient with TB on directly observed therapy, DOT? Answer. Emphasize medication adherence and follow up with a health department. Rationale. DOT ensures compliance, preventing resistance. Follow-up monitors treatment, per CDC public health guidelines. 11. What is the nurse's first action for a patient with TB showing a cavitary lesion on chest X-ray? Answer. Maintain airborne isolation and notify the provider. Rationale. Cavitary lesions indicate advanced TB, increasing transmission risk. Isolation and notification ensure safety and treatment, per CDC diagnostic guidelines. 12. What should the nurse monitor in a patient receiving pyrazinamide for TB? Answer. Monitor for hepatotoxicity and hyperuricemia. Rationale. Pyrazinamide risks liver damage and gout. Monitoring prevents complications, per WHO TB treatment guidelines. 13. What is the priority nursing action for a patient with TB and a new onset of fever? Answer. Assess for infection and notify the provider. Rationale. Fever may indicate TB progression or secondary infection. Assessment and notification guide treatment, per CDC clinical guidelines. 14. What should the nurse do for a patient with TB and a positive IgRA test? Answer. Order a chest X-ray and evaluate for latent or active TB. Rationale. A positive IGRA indicates TB exposure. A chest X-ray distinguishes latent from active disease, per CDC diagnostic guidelines. 15. What is the nurse's first action for a patient with TB developing vision changes on ethambutol? Answer: stop ethambutol and notify the provider immediately. Rationale: ethambutol can cause optic neuritis, risking blindness. Stopping the drug and notification prevent harm, per WHO TB treatment guidelines. 16. What should the nurse teach a patient about TB medication adherence? Answer: take medications as prescribed and report side effects. Rationale: adherence prevents resistance and reporting side effects ensures safety, per CDC TB treatment guidelines. 17. What is the priority nursing action for a patient with TB in a crowded emergency department? Answer: place the patient in an airborne isolation room immediately. Rationale: active TB is highly contagious in crowded settings. Isolation prevents transmission, per CDC infection control guidelines. 18. What should the nurse monitor in a patient with TB and HIV co-infection? Answer: monitor for drug interactions and immune status. Rationale: HIV complicates TB treatment, increasing drug interaction risks. Monitoring ensures safety, per CDC TB/HIV guidelines. 19. What is the nurse's first action for a patient with TB reporting chest pain? Answer: assess the pain and notify the provider. Rationale: chest pain may indicate pleuritis or other complications. Assessment and notification guide diagnosis, per CDC clinical guidelines. 20. What should the nurse do for a patient with TB who is homeless? Answer: refer to social services and arrange DOT. Rationale: homelessness increases non-adherence risk. Social services and DOT ensure treatment, per CDC public health guidelines. 21. What is the priority nursing action for a patient with TB and a sputum smear positive for acid fast bacilli? Answer: initiate multi-drug therapy and maintain airborne isolation. Rationale: a positive smear confirms active TB, requiring immediate treatment and isolation, per CDC diagnostic guidelines. 22. What should the nurse teach a patient about TB infection control in the hospital? Answer: wear a mask when leaving the isolation room. Rationale: masks prevent droplet spread, protecting others, per CDC infection control guidelines. 23. What is the nurse's first action for a patient with TB developing jaundice on rifampin? Answer: stop rifampin and notify the provider immediately. Rationale: jaundice suggests hepatotoxicity, a serious rifampin side effect. Stopping the drug and notification prevent liver damage, per WHO TB treatment guidelines. 24. What should the nurse do for a patient with latent TB starting isoniazid therapy? Answer: teach about hepatotoxicity and provide pyridoxine. Rationale: isoniazid risks liver damage and neuropathy. Pyridoxine prevents neuropathy, per CDC latent TB guidelines. 25. What is the priority nursing action for a patient with TB and a new onset of hemoptysis? Answer: notify the provider and prepare for bronchoscopy. Rationale: hemoptysis may indicate severe pulmonary damage. Notification and bronchoscopy guide treatment, per CDC clinical guidelines. 26. What should the nurse monitor in a patient receiving streptomycin for MDR-TB? Answer: monitor for ototoxicity and renal function. Rationale: streptomycin can cause hearing loss and kidney damage. Monitoring prevents complications, per WHO MDR-TB guidelines. 27. What is the nurse's first action for a patient with TB showing miliary TB on chest X-ray? Answer: notify the provider and initiate multi-drug therapy. Rationale: miliary TB is a severe, disseminated form requiring immediate treatment, per CDC diagnostic guidelines. 28. What should the nurse do for a patient with TB who misses a dose of medication? Answer: instruct the patient to take the dose as soon as possible and report to the provider. Rationale: missed doses risk resistance. Prompt action and reporting ensure treatment efficacy, per CDC TB treatment guidelines. 29. What is the priority nursing action for a patient with TB and a negative sputum culture after 2 months of treatment? Answer: Continue therapy and monitor for adherence. Rationale: a negative culture indicates treatment response, but full therapy prevents relapse, per CDC treatment guidelines. 30. What should the nurse teach a patient about TB contact tracing? Answer: inform close contacts to get tested for TB exposure. Rationale: contact tracing identifies and treats exposed individuals, preventing spread, per CDC public health guidelines. 31. What is the nurse's first action for a patient with TB developing peripheral neuropathy on isoniazid? Answer: administer pyridoxine and notify the provider. Rationale: neuropathy is a side effect of isoniazid. Pyridoxine and notification manage symptoms, per WHO TB treatment guidelines. 32. What should the nurse do for a patient with TB and diabetes? Answer: monitor blood glucose and coordinate with the endocrinologist. Rationale: diabetes complicates TB treatment, increasing glucose variability. Coordination ensures holistic care, per CDC TB guidelines. 33. What is the priority nursing action for a patient with TB in a negative pressure room reporting dyspnea? Answer: assess respiratory status and notify the provider. Rationale: dyspnea may indicate TB progression or complications. Assessment and notification guide treatment, per CDC clinical guidelines. 34. What should the nurse monitor in a patient receiving ethambutol for TB? Answer: monitor for vision changes and color blindness. Rationale: ethambutol risks optic neuritis, affecting vision. Monitoring prevents irreversible damage, per WHO TB treatment guidelines. 35. What is the nurse's first action for a patient with TB and a positive quantiferin TB gold test? Answer: order a chest X-ray and assess for symptoms. Rationale: a positive IGRA indicates TB exposure. A chest X-ray and symptom assessment confirm active or latent TB, per CDC diagnostic guidelines. 36. What should the nurse teach a patient about TB treatment duration? Answer: complete the full 6 to 9 month regimen as prescribed. Rationale: prolonged therapy ensures cure and prevents resistance, per CDC TB treatment guidelines. 37. What is the priority nursing action for a patient with TB and a new onset of confusion? Answer: assess neurological status and notify the provider. Rationale: confusion may indicate TB meningitis or drug toxicity. Assessment and notification guide diagnosis, per CDC clinical guidelines. 38. What should the nurse do for a patient with TB who is a healthcare worker? Answer: notify the occupational health department and arrange testing. Rationale: healthcare workers risk transmitting TB. Notification and testing protect patients, per CDC occupational health guidelines. 39. What is the nurse's first action for a patient with TB developing a rash on rifampin? Answer: stop rifampin and notify the provider. Rationale: a rash may indicate hypersensitivity, requiring drug cessation and provider evaluation, per WHO TB treatment guidelines. 40. What should the nurse do for a patient with TB living in a shelter? Answer: coordinate with public health for DOT and housing support. Rationale: shelters increase transmission risk. DOT and support ensure treatment, per CDC public health guidelines.